Honorable President, sir, I am on behalf of Biju Janata Dal stand here to speak about this calling attention motion. It is really a burning issue. More people are using drugs and more illicit drugs are available than ever in our country. Especially the COVID-19 led crisis has made this challenge even more grave. Vulnerable and marginalized groups, youth, women, and the poor have been harmed the most, while more people use drugs in developed countries than in developing countries, and wealthier segments of society have a higher prevalence of drug use. People who are socially and economically disadvantaged are more likely to develop drug use disorders. The pain in the whole issue is that around 13% of those involved in drug and substance abuse in India are below 20 years of age. 9 out of 10 people with drug addiction begin using substance before they turn 18. It has a very bad impact on the person in particular and society in general. It comes with negative effects like higher risks of unintentional injury, accidents, domestic violence, and also death. Demographic dividend suffers, affects relationship with family, friends, creating emotional and social problems. Increase influential burden. Drug abuse seriously affects our health, security, peace, and also development. Drug dependence, low self-esteem, hopelessness can lead to criminal action and even suicidal tendency. However, major challenges to curb the drug menace exist. These are legally available drugs, lack of availability of rehabilitation centers, smuggling of drugs, disproportionate focus of law enforcement agency on cases of personal consumption of drugs rather than the root issue of drug trafficking, lack of distinction between addicts, first-time drug users, and recreational drug users. Having said about the magnitude, cause, and impact, I would like that under the leadership of Honorable Prime Minister Shri Narendra Modi ji, our Honorable Minister Shri Amit Shah ji has been pursuing a decisive war against the drugs menace, working with the Ministry of Health and Family Welfare, Chemicals and Social Justice and Empowerment also. We commend the initiative like strengthening the institutional structure, empowerment, and coordination of all narco agency, comprehensive awareness, campaigns, and de-addiction and helplines for support. We also appreciate the Nasha Mukti Bharat Abhijan, NMBA, to strengthen action and cooperation in achieving the goal of a sustainable world free of substance abuse. NMBA launched for 272 districts across 32 states, union territories will go a long way to address the problem in the most vulnerable areas. I also recall one of the Man Ki Baat speeches where Honorable Pradhan Mantri ji advised young population that addiction is not cool and not a style statement. His way of dealing with the most complex problems from all angles is truly praiseworthy. I would also like to highlight what back home in our Odisha state we are doing to address this issue. I would like to apprise the House that several initiatives have been launched by our Odisha government under the leadership of our popular Chief Minister Shri Naveen Patnaik ji to help the young generation develop a positive attitude that is proactive against substance abuse. Our Honorable Chief Minister says that in Odisha, it is imperative to give a serious push to efforts to contain drug abuse and drug trafficking so that the emerging problem is nipped in the bud. This can be done by a combination of demand reduction, supply reduction, and harm reduction measures. Odisha government has launched Navchetana program to curb drug abuse among the children. The program is being implemented under National Action Plan for Drug Demand Reduction in 10 selected districts, namely Puri, Cuttack, Jagatsinghpur, Angul, Sundargarh, Khordha, Ganjam, Baleshwar, Kendrapada, and Kalahandi for the next 3 years to reduce adverse consequences of drug abuse. The government has directed the district social security officer to implement the programs as per the state action plan prepared in line with the National Action Plan. As part of the programs, 10 schools in each of the 10 identified districts are being taken up to provide education and awareness on drug abuse among the school-going children in the age group of 11-18 years. Outreach and drop-in central in 5 districts like Cuttack, Puri, Angul, Khordha, and Jagatsinghpur have been set up to conduct outreach activities in the community for the prevention of drug abuse with a particular focus on youth who are dependent on the substance. A community-based peer-led intervention drive has been also launched in 3 districts, Puri, Angul, and Khordha. To conclude these things, there is an urgent need to prioritize treatment, education, and rehabilitation because stigma, shame, and silence will perpetuate the problem.
Thank you.
1 minute. Channeling funds towards the treatment and rehabilitation will go a long way towards the addressing the root of drug addiction. As a society, we must collectively envision and take steps to minimize the stigma and discrimination across the party lines. Let us move to health-based and human rights-led approach along with the institutional mechanism to address the issue. So in this regard
Thank you
also,
very much. Yes.
Thank you very much.